Hey, Coach, I'm so happy you found us on YouTube. Make sure you go down and subscribe and like, hit the bell so you get new things. If you want to learn the secret sauce of coaching, if you want to learn the secrets, if you want to have a mentor, go over and check out teachhoops.com for coaches who want to get better. 14-day free trial. Learn how to get rings like this. There is a secret sauce to winning. So go over and check it out at teachhoops.com, and let's head off to the video.
What is one thing a coach can change that would help reduce injury risk without needing more money?
Break up activities into parts of practice, not just whole. If you don't get at the root cause of the problem, then you are going to come back to the same problem. So I think the biggest myth that I would say, if I just rest, then magically this is going to get better.
Welcome back to the Coaching Youth Hoops podcast. I'm your host, Coach Bill Flitter. Rob, welcome to the show.
Thanks, Bill. Happy to have you, or happy to be here.
Yeah, you're used to having clients, so
I know.
right?
I'm used to directing the show around here.
Exactly. So now So I got some real zingers for you today. Just put you in the hot seat.
Perfect. Let's go.
Hey, so before we dive in, and we'll come back to, let's do it this way. I'm going to just hit you with the question right away to set the tone.
Sure.
And, we hear a lot about injuries in youth sports. And when you see athletes come into your office, they might come. It's not maybe necessarily just about the knee pain or the ankle pain. There's a story behind that pain that they're experiencing. What are you finding that is typically the story behind the injury?
Yeah, good question. I think there's the injury story, and then there's the non-injury part of the story. And the non-injury part of the story is a lot of what got me into physical therapy in the first place. I was a high school athlete. Got hurt on multiple occasions. Went into physical therapy as a patient. I think when you look at a lot of either athletic trainers or a lot of physical therapists or even a lot of orthopedic surgeons, a lot of us have the same background. Experienced the healthcare system firsthand from a patient perspective, got a taste of it and said, hey, this looks like a lot more fun than sitting behind a desk all day. This is how I can stay tied to sports professionally. And the niche just kind of fills itself that way. But I will tell you, I remember distinctly being a high school junior getting hurt, a high school senior getting hurt. I played baseball, I played basketball. The injury itself was, put it in this bucket here. The emotional side of not being able to be part of the team, especially in high school athletics, I think is something that I experienced firsthand, and I see, and I talk to a lot of my patients who are going through the same thing. Remember, in high school, a lot of your identity is wrapped up in who you associate with, and for a lot of us athletes, not to put a label on it, but especially now in high school, it's hard to get away from your team. I mean, it's year round in a lot of cases. It's
sure.
you have practice before school, you have practice after school. These teammates and coaching staff become your family. You travel with them. You're on the bus with them. So to lose that. And I remember, especially those injuries where you're not in a cast, those injuries where you're not on crutches, where there's a visual, hey, you clearly can't go. But it's these repetitive shoulder things, repetitive knee things. There's this real sense of loss. Your community is going off on a trip together, and there's stories that happen on the buses. There's stories that happen in that dugout or on the bench, and you're not in that community anymore. So, I think when I have conversations with my athletes in the clinic, one of the first things I tie into is like, hey, how are you as a kid? Like, how are you staying involved with the team? Are you going to practices? Are you showing up? Are you still being part of that community? Because a lot of the drive to get back, especially for those high school athletes who maybe aren't going to play in college, or maybe have aspirations of playing, Division 3 basketball, or NAIA or something like that, where they just want to be part of a team. Um, that is so meaningful to them. So, first and foremost, how do you stay integrated, and how do you what are you doing to stay connected? Are you showing up to practice? Even if you can't do X drills because of your injury, how can you stay doing the other ones and not just say, okay, I'm gonna disassociate altogether? So, regardless of the injury, that's usually where I spend a good chunk of my time up front. And then
Hmm.
what I want to make sure is that my clinic kind of becomes their own team away from team, right? I can be there as a teammate. My staff is there as a teammate. We acknowledge when they come in. We're high energy. We're motivating. We want this to be a community in and of itself, for them, away from the team too. So that's where I tend to start with most of my athletes.
So you're a physical therapist, a clinic owner. You also, and we're going to dive into all of these things. And you also started an app, or created an app called Bounce Back, and it's a AI-driven injury recovery platform. Is that the right terminology for
I
that?
think I think if you have to put it in a box, sure, that's a good
Yeah.
place to start.
There we
Yeah.
go. And so you bring a wealth of knowledge. You've seen a lot of injuries over your career, and one thing that I struggle with as a coach myself, and right now I'm coaching a grade school team, is kids don't know the difference of, oh my gosh, I just fell, tweaked my ankle, and of course it hurts. They're
Yeah.
emotional, they cry. They're not good reporters, I guess, is what, in my opinion, right? So
Yeah.
knowing the difference between sore, tired, hurt, injured, nervous, right, burned
Sure.
out, because they
Sure.
haven't experienced it long term. Their body of knowledge is smaller. So,
Sure.
as parents and coaches, what should we listen for in the language kids use?
Well, I think, the word listen, I think, is actually the key phrase there.
Hmm.
I think sometimes, and this, look, your audience is going to have a wide range of folks, from everybody's, hyper competitive AAU to
Correct.
maybe CYO. Um, and so, really, just first and foremost, listening to the kid. Like, what are they expressing? What are they telling you? And trying not to react as a coach, or sometimes the hyper aggressive parent, and resist that urge to be like, hey, just dust it off. You're fine. Get back in there. When they're really saying, hey, it hurts. There's the unique breed of kid that is will play through anything.
Yeah.
Uh, that I see fewer and farther between, especially when it comes to traumatic injuries like you're describing. Most of our injuries, especially, maybe not so much in the 3rd, 4th grade world, but once you get into the high school world, fall into kind of 2 camps. There's the traumatic, "Hey, someone came at me from the side of my knee playing football, and I,
Mm.
I have this pop in my knee." There's that traumatic side. And then there's the, high school swimmer in their senior year, and they've had shoulder pain for 2 years. It's just gotten worse and worse and worse. Can't see it. There was no moment where it hurt, and it's only on one side. So we talk about this non-traumatic, asymmetrical type of pain, and you kind of manage those two types of injuries in a much different way. Obviously,
Yeah.
the first and foremost, the first type of traumatic injury, that's something where there's not a lot of thought process around it. It's pretty immediate. Let's kind of get you on your way. Even the ankle sprain, when you see a kid who's actively limping, whether they're playing it up for their parents or not, they're telling you that they don't want to play. And so I think at some level you have to respect that, and you can kind of get into the whys and the what's around it. Maybe not right in that moment, but week 2, week 3, week 4. Uh, but quite frankly, I mean, this is where kind of the thought process behind this whole app had its origins. I was a still am a parent. I've got a 21-year-old, a 19-year-old. Both of them played CYO basketball. Both of them played little league. I had a lacrosse player in there for a little bit of time, and I showed up to games. I showed up to every game, and it was when you're part of a team and you get to know the parents, it becomes um, not long before the parents get wind that there's someone in the health community. I'm sure I'm sure the parents who are listening to this podcast, who, if you're a coach, you know which parents are doctors, you know which parents are PTs, you know which parents are nurses, et cetera. And so it was often, hey, Rob, can you check this out? Hey, Rob, can you take a look at this? And I loved it. And it was great. And I loved being the resource for
Mhm.
every team that I was either coaching or a part of. Uh, but also recognizing that not every team maybe had a PT or a nurse or an orthopedist or a trainer as a parent member. This is where the origins of the app came to life. And it's like, hey, if only there was a tool, if only there was a good way to get information, right? Because I think, to your question, what do parents do? What do coaches do when their kid gets hurt? There's the, "Hey, we need to go to urgent care right away," or there's the, "Hey, let's Google it. Hey, let's go on to, any source of, information on the internet." And what I found in my experience is that the information is generally pretty generic,
Mhm.
if it's just an online search. And urgent care can be great, but it can also be overkill, right? I mean, it could be way too much for the moment. And so, yeah, trying to thread that line and trying to, fill that information void as a coach or a parent, it can be hard. And so I think, this is a very long answer to your short question. But what's the first thing that your
Yeah.
parents should do? I mean, it's just listen.
Let's jump to overuse. Right, we
Mm.
hear a lot about overuse injuries. Um, First off, simple definition of what an overuse injury really is,
Sure. I mean,
and then we'll dive into
as
that a lot deeper.
Sure. I mean, there's a simple definition, but maybe there's a lot of complex
Correct. Yeah.
reasons behind it, right? Um, the body is meant to pretty miraculous. It's designed to help heal itself, uh, but it needs a moment in order to go through that process. And the typical overuse injury is just that body not having the moment or the integrity to go through the normal inflammatory remodeling and recovery period that it's designed to do. When you and I were playing sports, you played, basketball in the winter, you played baseball in the spring, maybe you played football or something else or soccer in the fall. And so your body had this natural chance to not use the same structures over and over again. And as you're well aware, I'm well aware, I've raised kids through the last decade of youth sports. Just this seemingly not the case anymore, and for a lot of factors. But the idea of swimming year round and doing overhead sports like pitching year round,
Mm-hmm.
volleyball where you're jumping or swinging overhead to spike year round, there's no recovery period here, or the recovery period is just too short. And so when we talk about overuse injuries, it's I think we kind of start to blame the body. We shouldn't be blaming the body. The body's doing its best. It's just trying
Right.
to do what it's designed to do. We're not really giving it the chance to show up and perform like it's supposed to.
And what is the biggest overuse injury or an injury related to overuse that you
Sure.
see?
Yeah, it's a good question, and it's probably a little sport specific. My freestyle swimmers, my baseball players who pitch or catch, my volleyball players who are maybe outside hitters. it's going to be overwhelmingly a shoulder problem.
Mhm.
The downside of these where we have come over the last 10 or 15 years. I don't know if you went to Catholic school. I know a lot of my friends went to Catholic school, and you'd have nuns who'd walk around and say, "Hey, sit up straight." Well, they also didn't have like phones and laptops that were constantly
Mm.
driving. And I
Mhm.
hate to throw technology under the bus, but we are already a forward society. Everything we do is in front of
Mm.
us. We're
Mhm.
naturally geared to come this way. We don't do anything instinctively that pulls us back into this neutral position where our ears and shoulders and hips kind of stay in this plane, which is ideal where the shoulder wants to be when you're doing
Mm.
any overhead type of activity. And
Mhm.
not to get hyper clinical here, but you can imagine as your shoulders start to round forward and the muscles in your back aren't good at keeping your shoulder blades positioned where they're supposed to be. And then you start to just over grind and use this repetitively with, hundreds and hundreds and hundreds of hits or spikes or strokes. Tissues start to get inflamed. So for my overhead athletes, a lot of it is a shoulder problem. The pains is shows up here in the shoulder. The root cause often when we talk about, especially like this non-traumatic asymmetrical, meaning it shows up on one side but not necessarily on
Mm.
the other.
Mhm. Mhm. Mhm.
These non-traumatic asymmetrical injuries, you really need to go back and look at mechanics. I think if your son or daughter or your patient is in a rehab experience and everything is around, hey, let's put some ultrasound and some stem and heat on this and we'll call it a day, and they're just kind of rubbing the shoulder. If there's not a real focus on what is the root cause behind why that is starting in the first place, then it's time to shop around and look for some other folks. Because you can treat the symptom with rest. That obviously can get better. You can heat something, ultrasound it, stim it, whatever, and things are going to have some temporary relief. But if you don't get at the root cause of the problem, then as soon as you jump in back into the pool, as soon as you start, hitting spikes again, you are going to
Mm.
come back to the
Mhm.
same problem. And so, an overuse type injury, I think. What we want to focus on is all right, the mechanics involved, besides rest and besides just, giving that structure time to heal, that in and of itself isn't going to solve the problem. There needs to be some understanding mechanically of what's driving that in the first place.
Mm.
Uh,
Mhm.
when it comes to your lower body exercise or lower body sports, I mean, I put like soccer is in that, basketball is
Mm.
in that. Ones where you're grinding a lot. We see a lot of patellar tendon issues. We see some hip bursitis issues. A lot of science and a lot of research looking at, especially female ACL injuries,
Yeah.
tying that back to the mechanics again. What leads to a fragile ACL? Well, it's not just the overuse, but it's like, well, what muscles are maybe not playing the active role that they're supposed to, which puts the ACL in jeopardy so that you have that random landing off a rebound, or that, hey, I just planted and kicked and suddenly I'm down. Nobody even touched me. Those type
Mm.
of
Yeah. Yeah.
injuries, I wouldn't say they tie back to overuse, but in a way, again, it goes back to the same thing I was talking about with the swimmers, which is, hey, there's a mechanical insufficiency here that's putting too much load, too much stress on certain structures over and over and over again, and then the ultimate catastrophe happens.
Give us an analogy to really uh, help us understand this from a parent or coach perspective. So I'm going to throw one out and see, and
Sure.
you can get clinical on me and say, no, that's not true. But I'm thinking, okay, you tell me to go work out, right?
Sure.
And my definition of working out is only doing biceps. That's all I do. I worked
Yeah.
out, right? And I do it over and over and over again. And the result is pretty big biceps.
Yeah.
Would that be kind of an analogy, if you will,
Sure.
to think about like you would never do that, first off, right?
You'd be surprised.
Seriously? Okay.
You'd
Say
be
there.
surprised. I
Yeah.
guess the patient. We call those mirror muscles, right?
Uh-huh.
All the muscles you can
Yeah.
see in the mirror, for sure.
But is that the kind of idea where, yeah, you might not be going and just doing biceps, but you're pitching the same way all the time for,
Uh,
and that's what your workout is.
yeah, absolutely. We are, again, not to get too clinical, but you can imagine we are an organism that is built off what we call reciprocal paired partners of muscles. So you
Mm,
mentioned the bicep.
yeah.
The bicep does a very good job of flexing the elbow. Well, the bicep doesn't push the elbow straight. It needs a partner muscle on the other side to do the opposite action, right? So your tricep is equally important to elbow motion because it's a reciprocal partner of the
Mm-hmm.
bicep. When we think about throwers, right, we think about that as a very forward motion. We think about all the muscles
Is that
in the.
just your two seam fastball right there?
Yeah, you like that? I can mix it up for you if you like. That was my strong two seam fastball. Um, we think about that as a very forward motion.
Yeah.
What we don't think about is okay, once we start that process, there needs to be muscles in place to stop that motion,
Hmm.
right? There needs to be brakes. And what we find is that our body will only let us go as fast as it will slow us down,
Hmm.
right?
Yeah. Yeah.
So if Johnny, who's 13, just pitches and maybe he's got a weight training background, he's doing all those front muscles but nothing towards the back. This is where these overuse type injuries happen. It's often an issue of asymmetry between paired partners, or in the case of the shoulder, such a dynamic joint that has so many muscles, so many ligaments, so many tendons that attach to help move that ball within that socket. When one structure becomes over dominant at the expense, really, of all the others, that's where we start to see problems start to raise up.
And I want to talk about the you treat the physical, and you've been talking a lot about physical, but injuries can be mental, meaning hard to. I have an ACL injury, and now I'm afraid to play again because I'm afraid I'm going to re-injure it or injure the other one or play tentative. Is how do how do we deal with that as a parent or a coach? What do we say? What help do we get for kids? Uh, can I assume that's not part of your curriculum as a physical therapist?
Oh, for sure. No, I think that's a massive part of it, and I
Hmm.
and I think where we try to intervene the most in those situations is try and make rehab as game like as possible. We want to
Hmm.
overtrain for situations that, the soccer player, the volleyball player may never even, come in contact with.
Hmm.
But,
Hmm.
uh, but show them, hey, your body can do this, and that's all timing and that's protocols, and we obviously don't start that on day one. I think day one, especially post op, whether it's ACL, whether it's rotator cuff, whether it's any type of injury that requires a certain amount of tissue healing. Day one is just working with the patient to say, "Hey, you will get better."
Yeah.
There's moments where all hope is kind of lost, and they're staring at their friends, like we talked about at the onset. They're staring at their friends on the field, at the court, and watching their community evolve kind of without them. So those early days are spent there, but towards the later half, developing that confidence is really about overtraining. In my experience, it's about not just setting up game like situations, but how can you prepare them for things that they can't even think of, situations that are new and novel and different. And a lot of that's working with their trainer too. PT is great, but they should have a relationship, especially when you get into high school, with their athletic trainer. And their trainer should be part of that conversation. Their trainer should be encouraging them along the way, and partners with what we do, along with their physician, with their orthopedic surgeon if they have one. So that community should be helping to support their confidence, really through every phase of this.
Yeah. Yeah, I think about my own injuries in the past and think how long it took me. I had an Achilles injury, so it took me not
Negative.
only the recovery of the Achilles injury, but then I was like, "Is this worth it?" Right? I started doubting, "Is this worth it?" Like, that was hell for a year, coming back from that and learning how to walk again almost, so
I
we're
tell you,
not all
I
Aaron
have.
Rodgers and Kobe Bryant, right? So,
Well, yeah, your level of, and this is no slight on you, Bill,
yeah.
uh, but perhaps maybe your level of peak performance wasn't at the same level as
No, no.
as Aaron Rodgers
Close, but not
or
quite.
Kobe.
It was
Right there,
really, really close.
right there.
Right there. Yeah.
Uh, but
Yeah.
obviously, and I get the parents of kids who ask all the time, well, if Kobe can come back or if anybody else can come back so
That's where I
quickly,
was going with that. Yeah,
why
exactly.
can't I?
Yeah.
And
Yeah.
realize that these folks, when they got hurt, were literally the top fraction of a percent
Yeah.
in terms of athletic ability and strength and talent that any of us are.
Yeah.
So that's one factor. Two, they have access to
Everything.
tools and training and everything. I mean, it's their full time job, right?
Right. Yeah.
They're
Yeah.
not also going to punch a clock 9 to 5 doing
That's
something and
right.
then
Yeah.
dabble in some rehab here and there. So there's a lot of a variety of factors,
Yeah.
but those two probably being the biggest. But I think you bring up a good point. Is how do we set expectations? And I generally fall in the camp of, under promise, over deliver. I think that when it comes especially to the post surgical patients, uh, it's not about necessarily being conservative, but I think there's very little upside to uh, rushing a patient back so quickly that they re-tear, re-rupture,
Yeah. Yeah.
and now we're starting this whole process over again. So, working with the surgeon, understanding their protocols, understanding their guidelines, staying in constant communication with them, letting them know how the patient's doing. These surgeons were in the joint; they saw it. They understand the integrity
Mhm.
of what they were doing, and so the other piece of this too is, okay, so maybe the shoulder is on the shelf for a little bit, but what else can we be doing?
Yeah.
Find me a youth athlete that doesn't need core work, one that doesn't need better glutes, one that doesn't need better, hip stabilizers. Um, one that needs another better balance or stabilization. I don't care if you're a swimmer or a golfer or whatever. Any sport
Absolutely.
can be benefited from having that type of added strength and stability to their repertoire. So even if the shoulders. How do we make them feel productive? How do we make them feel like they're still actively rehabbing, even if there's not maybe a whole lot we can do with the shoulder or the knee.
Well, one thing I always say too, like, especially the basketball athletes, if they hurt their dominant arm, hand, whatever, and they can't use it, I
Right.
always turn it around and say, good, now we can practice on, right, the other one, right? Learning how to
Abs-
dribble better with that side, right?
Yep.
So I
Yeah.
think that's how you have to think about it. I think from an injury perspective is you still can do something unless
Yeah.
you're
And
in a
I
full
think it's,
body cast, right? So
which
different
is
story.
unusual.
Yeah.
Yeah. I think, tapping back into that. I mean, even your ankle sprain patient, unless they're really on crutches and,
Correct.
are totally non weight bearing, go shoot free throws, man. Get really good at the line. Get really good at the line. If it's your golfer with a back problem, hey, go putt. I mean, there's a lot of things you can do within your sport that can continue to work in your game. And even if it's minimal upside from your game perspective, it goes a long way to stay part of your community, man. A
And
long way.
this is a great segue into oftentimes what I hear is active rest.
Mhm.
What does that mean?
Yeah, I think that's what we've been describing here. I think that's exactly it. It's finding those things you can do while, if you're in a protocol, for example, you're week 6 from a 6 weeks out from a rotator cuff. Well, you're not able to pick a ball. You can't go pick up a ball and go throw. But hey,
Mhm,
what can we do with that? The internal external rotators of your hip. What can we do with your transverse abdominals? What can we do with your multifidi? What other muscles around your core, trunk, lower extremities can we use to, shift eventually some of the stress off of that shoulder and put it back onto some of the, other mechanical structures that, help pick up velocity, help pick up strength, and make you a longer lasting, higher endurance athlete down the road. I mean, I
mhm,
think it's a great opportunity to do, quite frankly, what multiple sports used to do for us as kids.
mhm,
It
mhm,
that
mhm,
was the thing. Active rest from being a basketball player was going to play, soccer for a season. It was going, getting out of soccer and going to play baseball for a season where you didn't run as much, but you used different muscles. That was active rest. It
mhm.
was great. And,
Yeah.
when you go back to like oftentimes I refer my patients now to players that they have no idea who we're talking about. But if you look at John Smoltz, if you look at any of those big three Atlanta Braves pitchers who seemingly had Maddox, right?
Mm, mhm, yeah.
Careers that were just they'd pitch 8, 9 innings a game, and they had outrageous careers that just spanned literally decades with seemingly very little injuries. uh, those kids grew up surfing and playing soccer and
Yeah.
and not being a full-time baseball player. And
Well
and so, I've got a outstanding high school boys volleyball player right now,
mhm,
really talented, is gonna go play in college. I literally had to tell him, You need to take an off season as it's part of your regular
mm,
season.
yeah.
You view it as an off season. I view it as part of your ability to continue to grow in the thing that you like to do. Even professional athletes have an off season,
Yeah.
right?
Right,
I mean, we're
right.
not giving this. We expect our kids to
Yeah,
eventually be professionals. Professionals take an off season.
yeah,
This is
for
what they
sure.
do.
Yeah.
And you see what the good ones do in their off season is they do things outside of their main sport, not just physically, but emotionally, mentally.
Mentally, yeah.
Get outside of that. And
Well, and
and
that's I want to stop pause you right there because I
yeah.
think it's important. This message is really important. And what I see and hear is, well, if I take an off season, I'm gonna fall behind. All right.
Mhm.
Somebody's gonna pass me up. Or it's that at least that fear is there. Right, I
Yeah.
can't imagine you this kid you were talking about who's gonna go play volleyball in college, and you're telling him to take time off so you can be a better athlete. He's looking
Right.
at you like, "You're out of your mind, like, I can't do that," right? But you and
Right.
I know that's probably the best thing for him.
Yeah, we've in a lot of ways created a monster, right?
Right, yeah.
Where and it could be just, yeah, I need to keep practicing so I can keep up with others, but um, I've got to play so I can get eyeballs on me, right?
Well, that's the other thing, yeah, right? Yeah,
You know,
absolutely, yeah.
and so, I think we've created an environment where we don't. And I'm not suggesting, hey, Billy, who's 16, he wants to go play D1 something somewhere, just sit on a couch all summer.
Right,
I
yeah,
mean, that's like
yeah, that's
that's
right.
not going to help,
No, it's
right?
not gonna help either,
Um,
yeah.
but I think there's a value add to, if you do have a relationship with a coach, if you do have a relationship, with a PT or something like that, and saying, hey, look, coach, I want to make sure that, hey, that injury, I had last fall that I kind of worked out of, I don't want to go have it again this fall. So I'm going to take 6 weeks out. and I'm gonna stay, stay out of practice so I can go do X, Y, or Z. I think a forward thinking coach, I think a new generation of coach, and maybe it needs to be structured for the coach. Maybe it needs to be, if you're a freshman baseball player and you've been having shoulder problems and you're being asked by your coach or whatever to play summer league, maybe you do need to come up with depending on the relationship with your coach, hey, this is my off-season script. Instead of going to Turlock, where I can, go get like go, ride the bench for or go, have maybe 4 at bats and but now I'm pitching and now I'm going to throw 200 pitches over the course of 3 days. Maybe that's not this as valuable as saying,
Yeah.
"Hey, I wanna take this 6-week program, stay home, and this is how I'm gonna be doing, and this is how I'm gonna be getting better." And I think there needs to be an avenue for that conversation and quite frankly, a reward, and recognition there's benefit to that.
Let's dive into you mentioned the coach, and so let's take a typical, you know, since we're talking basketball, right? Or
Yeah,
this
sure.
basketball podcast, AAU,
Yeah,
practice 2 days a week, right? Usually hour and a half, 2 hours, depending, and then tournaments on the weekend. And, you know, the good ones do it every other weekend, right? So there's not playing every weekend.
right.
But okay, so I have 90 minutes. Give me a practice that helps prevent injury longer term or short term, but just like, what should I do? You'll make it
Yeah.
practical for the AAU basketball coaches out there, or grade school coaches even. We got limited time.
Yeah.
Yeah, does that make sense? So what is our part?
Uh, I think that's a great question, and I think in basketball, the nice thing about basketball is there's a lot of different elements to the game, right? There's the shooting, there's defense, there's passing, there's a lot of different ways to break up a practice and incorporate all of those things rather than saying, hey, look, I've got 90 minutes. Today's all going to be rebounding. Today's all going to be shooting. Today's all going to be whatever.
Right.
Break down those practice schedules in a way where you are really trying to incorporate 10-15 minutes on this one thing, and then we're going to a whole separate that, hey, if it's all box outs for 10 minutes, great. And then we go into something that's just layup lines, or it's finishing drills, or and then we move into free throws. So that high variety, high different touch points, I think from a coaching perspective, not only keeps their bodies doing different things, but keeps it fresh, right?
Yeah,
Keeps it
sure. Mentally,
interesting,
right?
keeps it
Yeah, it's a good
different,
thing.
right?
Yeah.
I mean, the attention span of a 10, 11, 12-year-old boy is
Yeah.
I've been and I've raised
Right.
two.
Yeah.
And I've coached a bunch of them, so I get it. So I think even if your practice plan, coming off of the tournament was like, oh my gosh, we got to box out. Yeah, you do. Okay, well, let's break this up and maybe do it a few times during the practice, but don't spend, 30, 45 minutes just on that. I think that's a big one.
What
Uh,
about dynamic warm up versus warm up?
sure.
And do I need to always think about, okay, this is the warm up phase and we're doing, if I'm basketball, right? I don't have a ball in my hand and I'm touching my toes. I'm walking, back and forth.
Yeah,
I'm just trying to think of a bunch now. I'm blanking, doing
sure.
squats or whatever it is.
Yeah.
Or is lightly dribbling a basketball in a circle a good way to do it? And then, and I'll tell you how I do my practices
Sure.
in a 90
I'll give you
minutes.
validation, though. I'll
Give me
give you validation.
no, and tell me if this is crazy, but because I often
Yeah.
get asked this. So I used to start practice where we do dynamic stretching, right? And then I thought, well, what's the difference? And tell me if I'm absolutely wrong. If we start out in a huddle, we do 5 minutes of just talking and dribbling. So it's not intense at all. It's not like we're sitting, okay, 2 pounds, hard as you can. It's like I'm letting them kind of ease into practice mentally and then physically, just movement.
Yeah.
And then the next thing we do are we do layups, which are full court layups. There's some more ball handling incorporated up the court. And it's not like you got to do, 100 layups in 2 minutes. It's like we're not necessarily in a huge hurry. There's some urgency to it because we want to get the number of makes, but it's not where my coaching kicks in yet. So they're getting some movement that way. So tear it apart, good, bad, indifferent.
No, I think that's all good. I think we also need to take a moment and recognize that, look, 2 practices a week and 10 minutes twice a week of doing dynamic anything and expecting that to make like a real functional change in kids, probably unrealistic,
Mm-hmm.
right?
Yeah.
I mean, if this is their only activity, if this is their only exercise that they're getting, and we're expecting 10 minutes before practice to be the thing that ultimately prevents them from getting hurt, I'm not sure.
Yeah.
Now, that being said, is there value to it? Sure. When I'm treating my patients, even in rehab, I don't just, go straight to missiles. We start progressively.
Yeah. Yeah.
We build up to that, and I think there's probably there's certainly a physical benefit to it. There's a mental benefit too, of kind of gradually not starting so abruptly, but kind of easing into things. But the idea is, when we start to do explosive activities, we want blood flow, we want circulation. I think about you and I, excuse me. We probably used to mow lawns. I know I used to mow lawns. You mowed lawns, and on a lawnmower, like a pull cord gasoline lawnmower, there's a little pump, right? There's a little
Mm-hmm.
button on the side where you have to prime it, right?
I may have to do a demo video in here just to
I know that I totally
totally know what you're
accept that.
talking about, though.
You
Yes.
know what I'm talking about. There's
Yeah.
a generation that has no idea. Go
Yep.
YouTube it. Fine.
Yep.
But you basically prime the engine, right? Before you start pulling on the ripcord, you're trying to get a little gasoline. You're trying to get a little fluid into that engine before you start to do something explosive. I think
Yeah.
that's the metaphor that I look for, and that I think about. When I get into a practice session, I think you want to train like you're going to play. So if you're in a sport that does a lot of dynamic things, I think doing dynamic warm-ups makes sense. I think you can comb the internet and you could find 100 different research papers on the best way to warm up. For me, and I think you are doing something which I think adds a lot of value, which is you're trying to do not just warm up, but some team building and some team environment, and
Exactly. Yeah.
having kids talking to each other. I think that's a great way to kind of multitask the warm ups. I think the other thing is, after you've done some dynamic stretching and maybe you want to get some, my gym coach used to call it getting a lather, where you start to build up a little sweat before you start practice, right?
Yeah.
Adding some competitive gamemanship into things, finding those drills where it's maybe not super explosive, but the heart rate is getting up. They're using their muscles, but there's some competitiveness there. Some types of relay races or drills or things like that are engaging and fun, and they also are getting us ready to move and be more explosive, building that lather, getting that sweat, but in a way that I think taps into what you're trying to do, which is that teammanship.
Yeah. Well, and so now, okay, we're at practice. Kid gets hurt.
Mm.
Okay. I'm not you. I'm not a physical therapist. I've seen a lot of injuries, though. I can, make sure that I assess the pain just like anybody I think would, or a parent would. We talk about it. If they're crying, I just say, comfort them, let them cry it out. I'm like, it's okay, get it out, take your
Yeah.
time, right? That
Yeah.
type of thing. And so where I understand your app would be really helpful is in the moment, right? Injury happens.
Yeah.
It's kind of my sidekick. my on-call physical therapist to assess this injury. Now, I'm going to give you a pro tip here as a coach.
Yes. Yeah.
Okay. Here's the pro tip. Just tell them you're going to start scrimmaging, and all of a sudden all the injuries go away, and that they're able
Right.
to run and jump and do everything they say they can't do. So
Right.
yeah,
Right. Or there's ice cream after
there's
practice,
ice
and
cream.
suddenly,
And also,
hey,
yeah. Anyway.
yeah, that is a strong pro tip.
So bounce
No,
back. Talk to me about bounce back. How does a coach use it?
sure.
Where do you or parent even? Right. So
Yeah,
walk us through
yeah.
it.
So again, this was kind of born out of my own experiences. I touched on earlier.
Yeah.
I'm a parent. I've been called off the sidelines. I've been called out of the stands to kind of take a look at things. Um, and uh, there are not every team has access to the healthcare professional on the sidelines, and so uh, you're right. I think as I've talked about this app to coaches and parents, I think one of the benefits is what do I do right now? What do I do in the moment? And how really serious is this? Uh, there are there are the unquestionable injuries, right? Where
Right.
you
The
know right
obvious
away,
ones.
and
Right.
that's not what we're talking about,
Correct.
right? I just wanna, level set. This is not, here to, "Oh, did I just tear my ACL or not?" There are some real clear indicators that, "Hey,
Yeah.
something's not wrong or something's not right here."
Yeah.
But
Yeah.
um, you know, I rolled my ankle, my knee hurts, I'm trying to play through this. What should I do? And you're watching your kid, in the layup line, and they're being really cautious about how they're landing on that knee or landing on that ankle, and you pull them aside, and yeah, it hurts when I do this, but now the coach is like, well, shoot, Jill is actually one of my best players. We got a tournament coming up. She says she can go. What's really going on
Correct.
here?
Yep.
He's got the
Yeah.
parents
Yeah.
who are
Yeah.
like, yeah, she's fine.
Yeah.
I think this was designed for something like that. When my kids were playing sports, I was in healthcare leadership, and so I wasn't as tied to the what I've now found the obstacles in terms of actually getting access to professional care, which exists right now. Um, I had friends I could call and say, "Hey, can you see?" I'd bring it to a friend's, bring my kid to a friend's clinic and say, "Hey, can we do some things?" That was all great. Um, since I've now back in the practice for the last couple years, what the typical story now is, kid comes to me. They maybe let's go back. Let's say it's Memorial Day tournament up in Reno for
Mm-hmm.
basketball.
Yeah.
Something happened. New onset of pain. They kind of waited for a little while. Ultimately, made an appointment with their pediatrician or with a doctor to get in to see that professional. That was 3 weeks. That was
Mm-hmm.
4 weeks.
Mm-hmm. Mm-hmm.
Then the doctor was like, "Hey, go to physical therapy. They'll work this out." Uh, we don't live in a healthcare desert here by any means. We
Yeah.
have access to some of the best care possible. Even in my clinic, I was having patients calling me and saying, "Well, it was 3 weeks before I could get in."
Mm.
So now it's been 3 weeks at best to see the doctor, another 3 weeks before they can see me. This is an AAU team. You've just taken 6 weeks out
Good
of an
point.
AAU season.
Yeah.
That's a real loss on a
Yeah.
lot of different factors. Not just getting into the kid's health, but also there's a monetary component here too of this kid who is as parents we're paying big dollars now to have our kids play these travel sports. The coach is warning, hey, can my what's going to happen to my team with this
Yeah. For
Jill not being
sure.
able to go. And so the idea behind this app is not, and I want to be very clear, this is not to put physical therapists out of business. This is not to, play doctor. This is not to
Yeah.
do any of that. Um, this is really to just fill that information gap, which otherwise gets filled with kind of blind. searching,
Mm.
or
Mhm.
maybe it's into ChatGPT, but without the right prompts, and so it
Right.
gets
Yeah.
noise back and bad information back. Uh, what the goal and hope was, hey, let's give parents, let's give coaches, let's give athletes a tool that is just more vetted, that lives in reality,
Mhm.
and and talks to patients the same way I would in a clinic. And so what we've done here is built in algorithms that say that basically give you a chance as the athlete or the parent of the athlete to, hey, describe what's going on, and then, just as if I was on a FaceTime call with you because you're my co-parent or whatever, it asks you the same questions the way that I would ask you. It's decision tree, it's logic based, and ultimately comes up with, the very first screen after you hit submit is, this is what you should do right now. Even though we kind of market this as a rehab app, and it is that also, because after it's what you do right now, here's a phased based approach with
Yep.
guardrails. Phase one, phase two. We don't even put timelines around it because we know every kid is going to respond differently. But we say, here's phase one. This is what you need to be able to accomplish in phase one before you move on to phase two, phase three, etc. Before going back to sport, and hopefully in that time they've had a chance to connect with a rehab professional to help get them along that way. But even that step before then, hey, the way you answered these questions, and we ask these questions again from a very medical focused, rehab focused mindset. Based on the way you answered these questions, these are the red flags. These are the concerns. Or, hey, these aren't the concerns. But if you have X, Y, and Z going forward, then you really need to go back and see someone, a medical professional, have someone check it out in a. So, for example, if the parent and the child is saying, hey, the common question, what's your pain level? Between 0 and 10, 0 is
Mm.
no pain, 10 is like the emergency room. Okay, well, that's a good place to start, right? But there's so much variability within that answer. The next question is, okay, well, when you try and do this, then what do you feel? Or can you do this or this or this? And if the answer is, hey, no, I can't really do any of the things without really provoking a lot of pain, then, hey, this is
Mm.
the opportunity for you to go get checked out. If the answer is, then you're watching your kid and you're saying, hey, Jill, perform this and this, and can you hop on one foot 4 times? Can you, raise your arm up overhead? Yeah, you can do all that stuff. Does it really bother you? And you're watching your child's face and it looks okay. Okay, well, rather than saying, I think it's okay. This is I
Yeah.
think it doesn't look too bad, but so I'll go online and say, well, she's got like a little bit of shoulder pain, but she can do. This is a guided, research, evidence based approach that starts you out where you are in that injury phase.
Yeah.
If you really are an 8 out of 10 and you really have some troubles doing this, then even those 3 days before it might get you to go to see urgent care or your primary care doctor, those 3 weeks before it might be, before you can see your pediatrician, even then, here are some things you can do to manage that level of discomfort. Oh, and by the way, don't do these things because you've got some indicators that this is maybe
Mm.
more serious than we're giving it credit for. So that was really the design behind this, is let's give parents, let's give athletes something besides just the blind Google search, just the blind chat GPT, whatever, that can be helpful, not just long term in the rehab space, but in that immediate moment. And so for a coach, you're watching and it's like, well, here's something you have in your back pocket you can pull up, and you can help, or as the parent shows up, you maybe answer those questions together, and at least it's an informed place to start.
Yeah, and I think that's, I mean, again, as you know, most, you know, club programs, they don't have a physical therapist in the
No.
gym, and or even at tournaments, depending on the size of the tournaments
Right.
now, I think
Right.
there's some requirements that they have to have X number of physical therapists on
Right.
premise. But for, most of the time we don't have
Yeah.
anything.
Yeah. I mean, if you're CYO practice on a Tuesday night at St. Anne's Church, I promise you,
Yeah.
there's very likely not to
Yeah.
have a rehab professional unless, like I said, you suckered or conned some parent into doing it. But that's really what this is for, right? I mean,
Yeah.
this is
Yeah.
there's so many hours, and not only that, but I think there's a lot of kids, especially now, 14, 15, 16, l- living with this kind of, as we talked about, repetitive
Yeah.
strain type of nagging thing that is keeping me from jumping high as I want to for the rebound, which is keeping me from spiking the ball as hard as I can. Those things nag and they become really bothersome.
And that's
And
a really good point. I mean, it's not just about on demand and I need an answer now. It's, I have this kid that I've been training for a long time, and you know, we start shooting practice, and he complains about a shoulder pain every time he starts shooting. I'm like, go see a doctor. Right? But
yeah,
that's a great example of, okay, I have some chronic thing going on. Is it serious enough? Right? I just want an answer as a parent, even, right? That I
that's
could,
exactly right.
yeah.
And quite frankly, that is what takes longer to actually get in to see a doctor
I can
than a
imagine, right?
therapist,
Makes sense. Yeah.
than the
Right.
real traumatic thing. I mean, the real traumatic thing,
As it
as a
should, right?
parent, you're trusting your gut, you're trusting your
Right.
intuition. Hey, I'm going to urgent care. But even you go to urgent care, I mean, it's great for triaging. They'll put an X-ray, they'll give you an X-ray right away.
Right.
But a lot of times it's then, hey, I want you to go follow up
That's
with your
right.
doctor.
Yep.
And then I want you to go, and then you wait to go see the doctor,
Correct.
and
Right.
then okay, now I want you to go to PT. Well, that's easy 6 to 7 weeks now in this environment.
Yeah.
You know, what could I be doing? Even in between, and any PT will
Mhm.
tell you this, as we touched on earlier, active rest, right?
Yeah.
Even when that shoulder is really hurting, even when that knee is really bothering you, even when that ankle still looks swollen, what could you be doing while you're waiting to see the doctor?
Yep.
What could you be doing from the doctor before you get into PT? And I think this is what this technology is the gap
That's
that it's trying to
amazing.
fill.
Yeah, no, that totally makes sense. And I
Mhm.
yeah, I just think, well, one, it's an easy download, right?
Yeah.
So just
Yes.
keep it on your phone. All right. It's
Right.
it's it's almost like an insurance. It's sitting there. Right?
Yeah.
Yeah. When you need it,
Exactly.
it's there.
Well, and the other piece too is you talked about we've kind of gone back and forth about the emotional side of sports too.
Mm-hmm.
Giving your athlete at least something to do so they feel productive
That's a good point.
is
Yeah, for
really
sure.
meaningful.
Yeah.
It's really meaningful. You know, okay, I'm not just a passive player in this injury. Even though I'm hurt,
Mm-hmm.
your motivated patients want to do something. Your motivated athletes rather
Yeah.
want to do something. Okay, here's a safe space. Here's a protocol of things that where you are in your injury phase right now that you can do until you have mastery of these things. And then, hey, a lot of our athletes are pretty goals minded
Yeah. Yeah.
kids, right? And so we tried to structure with that mindset of saying, hey, here's goals. If you can reach these goals, then you get to unlock. You kind of gamify it a little bit, right?
Yeah.
Here's phase two, and once you can do all
Mm,
phase two, then there's phase three, and before you know it,
that's
they're
nice.
they're
Yeah.
on to phase 4 or 5, and so uh, it- trying to tap into some of that mental side of that and say depression, but obviously there's that downside again of not being active, of not being doing something productive.
So we were talking off air about my overuse injury of doing yard work. Well, can I
Yeah,
share this,
of
bring it
course.
up, phase one, phase two with my wife and say, I got
Absolutely.
active rest, active rest? No.
Yeah,
Yeah.
absolutely. I think the more I talked to the parent of athletes as I was kind of creating this and discussing it and brainstorming it.
Mhm.
Um, that often came up. Well, it's like,
Are you serious?
"Yeah, okay, I know I
Yeah.
know you're thinking about this for kids, but could I use it too?" I'm like, "Yeah, sure.
Yeah.
No problem."
Yeah.
Uh, it's, the way we've structured this, even though one of the first things we ask for early on is in the question answer period is age. And so it
Mm,
takes that
mm.
into consideration.
Yeah.
We ask about like, okay, were you playing a sport? What were you doing when this kind of happened? And
Nope,
so,
just bent
uh
over, picked up the hose.
No, just old.
Yeah, just
I'm just
old, yeah.
old now.
Yeah.
I just got new aches and pains. I don't know if they're ever gonna go away or if this is just how I'm gonna live the rest of my life now, and, yeah, it works for that too.
Yeah,
It works
okay,
for that
good.
too.
Well,
Yeah.
let's I got one big question and then I'm gonna a bunch of rapid fire questions for you. So let's start with the big one, which is okay, you in your possession right now, you have a magic wand. And if you could change one belief when it comes to youth sports injuries, what would it be?
One belief about, just rest will make it better.
Like simply like that is not that's not gonna happen. Like active rest is
Just
what you're saying.
yeah, yeah, the perception that, okay, my elbow hurts,
Mm-hmm.
this, the 13-year-old pitcher go to a tournament, elbow hurts.
Yeah.
I'm just going to rest it for a week and
Okay.
then I'm going to be good to go next weekend.
Mm. So what
Again,
should they
that,
do? I mean, it's a great question. What should we do? That's common, right? That's a common thing. Oh, I'm
oh,
just a little like a little sore.
oh,
I should rest. I mean,
yeah.
where are
And
you telling us to go from I'm a little
yeah,
sore, I'm gonna get some rest. What should I
yeah,
do instead?
rest is good, but understanding that there are mechanical forces at play that have led to that injury. And so understanding, yes, you want to allow for tissue healing.
Mm-hmm.
Okay. But if you keep just going back to doing the same thing the same way, like, of course it's gonna come back. Like, you haven't done anything different.
Mm.
Like, it's like, well, yeah, my head feels a lot better when I stop banging it against the wall. Sure. So I gotta stop banging my head against the wall for a week. But as soon as I go back to banging it against the wall, it's weirdly it hurts again.
Yeah.
Of course, right?
Mm.
So there needs to be in these overuse type injuries, there needs to be an understanding that there is a mechanical issue at play. Often with our repetitive throwers, where it's shoulder and it's elbow, they're arm throwing. They're just using too much upper extremity force. They haven't really learned how to use their core, how to use their hips. There was a game that
Mm.
you and I used to play on the playground. They probably don't let kids play it anymore. It used to be called like Whip It or the Chain or something. And you'd get 8 buddies, 9 buddies, and you'd all interlink arms, one, holding hands down this chain, and one kid would start to make a circle, and the other kid down at the other end of that chain would go flying like a whip, right? Um, maybe my upbringing was a little different, but I'm sure there's listeners who have played this. Anyways, um, it's a real good analogy for how stability in our core creates velocity down the chain.
Mm.
Okay,
Mm-hmm.
and so if all you're doing is working the last little bit of the motion, and you're not doing anything that's designed to initiate and be the driver of that motion, then you're going to come back to the same injury. So I think the biggest myth that I would say is that, hey, if I just rest,
Mm.
then magically this is going to get better. And for your repetitive strain injuries, it's just not.
It's
There
just
needs
not,
to be
yeah.
an understanding of the mechanics involved of what drove that injury in the first place.
All right, let's get into rapid fire. So
Sure.
just
Are there
yes.
points for this? Is there like
Yeah,
a
you get
give me like
this
a
gamified. Yeah, yeah.
fantastic?
Or the last guess, scored 1,000 points. No, I'm just kidding.
Okay. Oh, now
So,
I know I've
all
got a
right,
competition.
start off with an easy one. Rubbing dirt on it, does it work or not?
It depends on the dirt. If you get clay from the Himalayas and
Then it
it's
works.
really refined and blessed, then you might have a shot.
All right, good answer.
But if that is your strategy, at best your kid is still staying injured. At worst, your kid has also lost faith and trust in you as either a parent or adult in terms of looking out for their best interest. So, yes.
Uh, all right.
Yeah.
Youngest athlete you treated for repetitive injury?
Great question. I mean, I had a 8-year-old girl soccer player.
Mm,
Is probably of recent memory.
hmm
Um, and for wasn't even for AC, it was for patellar
mm,
tendonitis. Yeah.
mm. The healthiest young athletes are not the ones who.
Uh, do the same thing over and over again.
Hmm
They're the ones that the healthiest young athletes are not just playing travel baseball, but they're
mm,
getting some cardiovascular in by playing soccer or basketball, and they're not just doing jumping sports; they're also doing cutting sports. The healthiest youth athletes are ones who are just that. They're athletes, not pitchers. They're
yeah.
athletes, not shooters. Right?
There's a trend in club sports trend. Well, maybe I won't call it a trend yet, but it's coming where, as you know, you join a club program and that club does one thing, right? Basketball, soccer, volleyball. There's a trend going on where now they're creating seasons, but you stay within that club. So one
Interesting.
season you're doing soccer, next season you're doing whatever basketball, third season you're doing X, right? So anyway, to your point.
I
Um,
I think that's great as long as you're also exposed to a variety of coaches and a variety of kids,
right.
right? And
Yeah,
we also want our, kids not to hear the same voice over and over again. We want our
correct.
kids,
That's a
you
really
know,
good point. Yeah.
social
Yeah,
interactions with people who are maybe different than them every
that's right.
once in a while. So,
Nicer,
yeah.
meaner, tougher, whatever it is, right? The whole
Yeah.
thing,
Or
because that's what,
yeah.
yeah. Yeah, yeah, for sure.
Maybe you get to be, maybe you're the best whatever shortstop. So all you've known is to be the hero on the baseball team. But, turns out in basketball, you can't,
Right.
shoot for,
Yeah.
a lick. So maybe you're not coming off the bench. I think there's value in that.
Okay, so what is one thing a coach can change this week that would help reduce injury risk without needing more money, more staff, or more technology?
Yeah. I think like we talked about before, add variety,
Hmm,
add variety and um, break up activities into parts of practice, not just whole practice. So, for example, if you really want your kids to be better rebounders, right?
Mm-hmm.
um, there's a lot of elements into becoming a better rebounder.
Yeah.
There's the boxing out piece. There's the jumping piece. There's the outlet pass piece. Uh, you know, breaking those up into parts of the activity versus just repetitively doing the same thing over and over again. So you can teach the multiple elements of the skill as parts.
Okay, and finally, for the parent or coach that has a child that is injured and they're afraid of them falling behind, what would you want them to hear?
Um, that your kid's a kid. I mean, there's this might be if this is their entire world and their whole emotional center is around falling behind, make sure that you are also investing and supporting the other things in their life that makes them kids and it adds value, right?
Yeah,
This is their whole worth can't be centered around the tournament that's coming up Saturday. So
yeah.
that's where I would start.
Okay.
And I think that we're seeing a movement towards that. I know when I was early on in my career, more often than not, I was treating the parent and not the patient. Quite frankly,
I believe it.
it's hard to hear some of these things.
Yeah,
Um, but take a step back and realize, hey, look, where else can I make sure that this kid's getting the validation, the support, the positivity, and also look, I mean, and the honesty. right?
Well,
I
right.
mean, I think there's also a subset of parents out there that really truly believe that their kid is going to be a pro, and that's a very small percentage. And I think attaching everything to that vision, that dream of being a D1 athlete,
Hmm.
maybe isn't setting these kids up for the best, not just emotional success, but I would say you're depriving them of also realizing some other talents that they may really, really benefit from.
Well, and I just had, I know I said it was rapid fire and we are wrapping it up,
It's all
but I
right.
just thought of two questions.
Sure.
One is the, have you had, have you had to tell an athlete you're done? Like, I mean, which, talking about hard and honest conversations,
Yeah.
um,
Mhm.
like,
Um,
because you're not going to come back. I mean, that's hard, I think, also from what you're supposed to do. You're supposed to make me
right,
better, right?
right,
You're supposed to
right,
help heal
right,
me, right? So this muscle or this thing or whatever, right, gets better.
right, right. I probably have never phrased it that way. Um,
My bedside manner sucks. So I'm just saying.
I probably have never phrased it that way. I think that there are moments for honest conversations,
Hmm.
and say, hey, look, my expectation, given your injury, is that we would be maybe further along than where we are right now. So let's figure that out together why we're not there.
Mm,
And
mm,
phrasing it
mm,
more like
hmm.
that than, hey, look, this injury just is going to sideline you, and it's just not in the cards for you.
Yeah,
And I've got some really resilient kids out there too. Some really resilient kids. I've got
sure.
I had a patient, female patient, played football, uh, high school football, and also rugby, and
Mm.
she tore her ACL playing rugby. This was, I think, her sophomore year, and rehabbed it. Even as a sophomore, she was already looking at schools like
She was a heck of a,
Brown.
yeah. I know who you're talking about. I don't know. Yeah. So
Incredible athlete, incredible
incredible.
athlete,
Yeah.
but
Yeah.
just a great solid kid too, right?
Right.
Um,
Yeah. Yeah.
and
Yeah.
and was looking at like big time women's rugby programs, like Brown, Harvard, a lot of East Coast schools. Um, Tore her ACL. We spent a year rehabbing her, getting back, had some funky little complications, and got her back. And literally, I think either a week or two, she's back on the rugby pitch, tears her other
Mm.
ACL. And I was devastated for her. Like, I mean, I was
Sure.
like on the
Yeah.
inside,
Yeah.
oh my gosh. And this kid just had a sense of resiliency that she's like, okay, I'm gonna rehab this ACL just like I did the last one." Fast forward, she's playing college rugby, and she's
Awesome.
doing great. And
Hmm.
but I would love to take a lot of credit for that. But her parents and her upbringing and just her DNA and who she
Yeah.
is formed a lot of her resiliency and grit and determination. So, we can do a lot as healthcare providers. We can do a lot as parents. Um, but if there's a level of determination, and I see this, I get asked, what do I see in the clinic that kind of separates those top level athletes from maybe those kids that maybe aren't going to go. It's dedication. It's the things that they are doing with no adult telling them to do it.
Mm.
You
Yeah.
know,
Yeah.
it is not, I'm going to practice twice a week because this is when we have practice. This is, yeah, I'm going twice a week to practice. And also in the other days, I'm so driven. I'm doing this, this, and this
Yeah.
on my own. Like the parents have to call me in um, from shooting in the backyard because it's 10 o'clock at night. Like it's those kids
That's
that
a
you
really
go,
good point. Yeah.
oh. those are the ones you have to peel back and say, "Hey, you've gotta you gotta take a break from this." They're the ones that go on. They're the ones that, have the mental makeup and the fortitude to grind. And if you're a parent who's just uphill pushing your kid to be the D1 athlete because you think they've got talent, that is a short road, man. That is a short road because if they're not, taking that initiative on their own, I, to me, that's the biggest
Yeah.
distinguishing
Yeah.
factor. Biggest, for sure.
You're pushing a boulder up a hill, right?
Oh,
Yeah.
it's
All right,
huge.
last point here. So,
Yeah.
and I wanted to definitely bring this up because it's something that we're testing right now. Um,
Yeah.
it's called Beyond Pulse, and it's a load management tool. And they have a youth version and a more, and youth meaning think high school and younger, and then they have
Sure.
a more advanced version for high school and all the way through college. And for me, and since we have this in common, the first time I've seen them, this was several years ago at St. Mary's College, and I was in the girls' practice, and they were wearing, it wasn't Beyond Pulse, it was something else. You probably
Mhm.
even know the name of them, but just the concept in general of a load management tool. Think about the grade school one, or the below high school one, as more of a gamified, supposed to be fun, gets the
Right.
kids in the mindset of just even thinking about info.
Yeah.
It doesn't go into the depth of some of these more advanced ones, and the high school one and above is more advanced, where you can literally say, Rob, you're done. Like, you're at
Right.
your max right now
Right.
capacity. So have you seen those in practice? And I'm assuming like more of your college athletes, you're probably seeing that. Talk to us
Oh,
quickly
yeah.
about that, and then we'll wrap it up.
Yeah, and I think you're probably dealing with 2 levels of athletes and maybe 2 various uses for this same tool. Certainly at the college level, high school, advanced high school level, you're, as we talked about, right? I mean, you need to give some tissues a break so other tissues can start to do more of the load, more of the work. And so any research around that I think is helpful and
Yeah.
productive. Um, as I look at the overwhelming majority of 9 through 12-year-olds, let's say, what we're trying to do
Hmm.
is,
Hmm.
in a lot of cases, like, let's get them moving. Let's get them active. Let's my uh you know my baseball players, for example, who are maybe throwing, um you know, I don't know what the pitch count limitations are, but let's say throwing a lot of balls over the course of a weekend. If there's a way to measure that and guide that, I think that's valuable. But also, hey, can we teach this kid to run a little bit? Because not a lot of running in baseball. Can we
Right. Right.
reward them for doing
Yeah.
some of the cross training stuff? Understand the load piece.
Yeah.
So maybe the soccer player,
Mm.
understand, okay, hey, you're loading these muscles, you're loading this part of it, but you're underloading, you're underutilizing some others. Can we get our heads around that piece of technology so that there's again balance and symmetry? I think that would be a great test case.
No, that's a really good point. Uh, so Rob, tell us where we can find your app. Can you hear me, Rob? Oh, no worries. Tell us where we can download your app. And I'll definitely put that in the show notes. And I appreciate you coming on the show today. I think this is a great discussion that needs to happen. We need more discussions like this, just from, because we're seeing, I know I am, we're seeing injuries increase. And I think, again, what you're trying to do with the app, helping coaches, helping parents diagnose this up front, and just giving us the really good information as next step in that phase approach, I think is right on. So thank you so much for your time, Rob. All right, coaches, until next time, this is Coach Bill. All right, thank you, Rob.
Hey coach, thanks for watching. Super appreciate it. Go down, subscribe and like, hit the bell up above, and go over and check out teachhoops.com for coaches who want to get better. 14-day free trial. Go check it out.